what would be your top tips, your recommendations for women? So they've gone through their birth plan, like you were saying, and what can they prepare feeding wise for when they do give birth and they are handed their baby?
So definitely consider collecting colostrum before birth from 37 weeks onwards. Even so there is some people who say, what if I give birth early because nipple stimulation causes some uterus contractions. It is highly unlikely that colostrum collection starts labor. It really isn't. So it is safe for the vast majority of all people. So familiarize yourself with the technique of hand expressing, start colostrum collection at around 36 weeks. That would be super helpful if people would be able to do that. And they can
Do you
come to
store that
hospital.
in the
Yeah.
freezer?
Yeah, so the 1 milliliter sterile syringes, you can buy them off Amazon or in pharmacy. Sterile syringes, they're single packed. So you put them make sure you label them with your name and your date and the date you collected it. And then you can put them in a clean Ziploc bag in the freezer. And then if you go into hospital, someone else can bring them or you can already go in with them. They last in the fridge. Um, and then you may or may not need them, but I think there isn't a situation in which a newborn that gets an extra 2 milliliters of colostrum will not feed because of that. Like that will always
No.
come in handy.
I'm just thinking my daughter, I went in to be induced, ended up having an emergency C-section, and then she had to go to NICU, and I couldn't join her for, gosh, a good few days. I had nerve damage. We won't go into that, but I was bedbound
Gosh.
basically, and I couldn't get up to the NICU. So I had to hand express the colostrum with the syringe. It was really, really hard. So I'm just thinking in those sort of situations as well, that would be perfect. Dad could take in the colostrum that's in the freezer and give it to baby. Yeah, that'd be a great situation to be in.